this is the abdomen. The region of the body in between the diaphragm and the pelvic floor is known as the abdomen. Here you see the cross section of the body, and this is the diaphragm, the superior boundary of the abdomen, and this is the floor of the pelvis. This is the inferior boundary of the abdomen. In between this diaphragm and pelvic floor, this whole area is known as the abdomen, but it has two parts. This part of abdomen is abdomen proper, and this part of the abdomen is the pelvic cavity. This abdomen and pelvic cavity is supported in the midline. This is the lumbar vertebra, and in the lateral side it is formed by the hip bones, two hip bones. In the pelvic, the midline, there is the sacrum and the coccyx. The hip bones has three parts. This is the ilium, this is the ischium, and this is the pubis. The ilium has the crest in here. This is the iliac crest, and it is the spine. This is the anterior superior iliac spine. It is the anterior inferior iliac spine. This is the anterior superior iliac spine, and this iliac crest has a tubercle, and iliac crest has a tubercle from where the transtubercular line passes. We will learn it later. And here is the symphysis pubis. The two hip bones meet in the midline through a cartilaginous joint. This is known as the symphysis pubis. It is a cartilaginous joint. And the abdomen is formed by different types of the structures along with this bony structure. Here we see the bony framework, and in the anterior part there is one muscle. This is the rectus abdominis. Along with the rectus abdominis there is the external oblique, the outside. In the middle is the internal oblique, and in the innermost is the transversus abdominis. These three muscles along with this rectus abdominis, they form the anterior abdominal wall. In the posterior side we see there is the psoas major, quadratus lumborum, and the iliacus. They form the posterior side of the abdomen. And the abdomen is, for the descriptive purpose, abdomen is divided into different regions through the horizontal and the vertical lines. Here we see the this is the abdomen, and this abdomen has two horizontal lines and two vertical lines, and this divides the abdomen into 9 quadrants. This is the transpyloric line. This passes through the pylorus of the stomach. Here we see the stomach. The stomach has the cardiac end and the pyloric end. The line passes through this pylorus. This is known as the transpyloric line. This is the transpyloric line. So here we see this is the transpyloric line, and here is the iliac crest, and here is the tubercle of the iliac crest. So the line that passes through this tubercle of the iliac crest is known as the transtubercular line. That original transtubercular line will be a little bit below this line, the transtubercular line, and this line passes through the middle of the clavicle and the middle of this is a mid-clavicular line. These two lines are mid-clavicular lines. So these 4 lines, transpyloric line, transtubercular line, and 2 mid-clavicular lines, divides the abdomen into 9 regions. Here we see 3 central region. This is the epigastric, this is the umbilical, this is the hypogastric, and this is the hypochondriac, this is the lumbar, and this is the iliac or the inguinal. This is the left side, and this is the right side. This is the hypochondriac, lumbar, and the iliac. These are the 9 regions of the abdomen. And abdomen, within this cavity, the abdomen has a magic box. There are different structures, different nerve vessels, and the luminal structures when the solid structures all are lies within this abdomen. We will learn it later.